As this debate over health care continues to rage on month after month after month, by the way, the powerful Senate Finance Committee will have its health care reform bill hammered out as early as Friday, and the rest of Congress will have to begin to debate it. The question is continually raised in this land of equal opportunity. Should all Americans do all Americans deserve the same access to health care that members of Congress have? How good is that? Well, our chief medical editor, Dr. Tim Johnson, takes us behind some closed Capitol doors.
Healthcare costs in this country are impossible for everyone.
When Wisconsin Congressman Steve Kagan, an advocate for health care reform, needed knee surgery last winter, he paid for it out of his own pocket. That's because Kagan, a medical doctor, turned down the health insurance options offered to members of Congress.
And refused coverage for himself.
Yes, I tell you what, I respectfully decline. Until you can make that same offer to everyone that I have the honor of representing, I just don't think it's fair.
But while his surgery personally cost him thousands of dollars, Kagan says he paid nothing for the extensive rehab he needed. That was provided by the U.S. government. In fact, Kagan and hundreds of his fellow members of Congress received some of the best health care in the country without ever even using insurance. And all right in the U.S. Capitol, at a little-known and rarely discussed clinic called the Office of the Attending Physician.
They have a very small pharmacy. They have physicians and nurses that will see you on the spot, on the beck and call. And they also have physical therapy available, which I took advantage of when I had my knee surgery.
And I assume members of Congress pay for this somewhat?
It's one of the, quote, benefits of being a member of Congress.
How much of a benefit? For a flat $503 yearly fee, members of Congress have access to almost all of the primary care they could ever need, right behind this door, from exams and EKGs to x-rays and minor surgeries, all provided by Navy doctors and nurses. Last year, about half of Congress paid the fee. And sources say if a particular specialist is needed, one will be brought to the Capitol. All of this for no additional charge.
Cardiologist, pulmonologist, dermatologist, gastroenterologist, rheumatologist, just a wealth of specialists that support the office.
We wanted to talk to the attending physician on camera about these services, but our repeated requests were denied. And when we tried to visit the office, we were asked to leave.
Okay, let me see what I can find out.
Dr. Eduardo Balbona is now in private practice, but he spent 2 years as a staff physician at the office in the 90s.
The customer service is excellent. A member walks in and generally walks right back into a physician's office. They are not rushed. They are examined thoroughly. Any test that is helpful is done.
In addition to serving members of Congress, the OAP also provides emergency care and first aid for congressional staff and tourists at small clinics and ambulances located on Capitol Hill. The office talks publicly about those services, but rarely discusses the first item listed on its mission statement, providing primary care to Congress.
We have a Cadillac plan.
Representative Lee Terry of Nebraska doesn't use the office, but talked with us about it.
This thing called the Office of the Attending Physician.
Oh, yes.
Which you smile and say, oh, yes. Why do you do that?
Oh, it's a great asset. Somebody passes out on a tour, it's our attending physicians that are there right then. But there is an option. You could use them as your, in essence, family practitioner while you're here.
What do you think of the congresspeople who do use it? We have heard stories of congresspeople who are just doing all kinds of things down there, bringing in specialists to see them, things that ordinary Americans just can't do.
Yeah, I haven't explored it enough, but I know that it exists, and it's a good deal.
Terry is introducing a bill to offer the same federal health insurance options provided to Congress to all Americans.
I'm sitting here thinking, if you're going to introduce this bill for the federal health plan, why not throw in something like this office that is provide primary care? If Congress can have those kinds of things, why can't we?
That's a fair question, and they should have that. Because frankly, having a physician that you can call and contact actually helps drive down the costs.
Again, we couldn't ask the office about this idea because it refused our interview requests. In fact, getting anyone to talk about the office was difficult. Some former staff were willing to talk off camera, but said they would get in trouble if they appeared on TV. In the end, only Dr. Balbona would agree to sit down with us because he says the office serves an important purpose.
It's not a political perk. Much like a medic who's in combat, it's not a perk to those soldiers. It's part of the mission.
And bringing in our medical editor, Dr. Tim Johnson, now from Washington, D.C. Tim, the unwillingness to talk about this says it all.
Well, I think it does. I think they're embarrassed, some of them at least, by the kind of service they have and their constituents don't have. And more importantly, Diane, I really worry that this kind of readily available care at a very low fee desensitizes them to what the rest of the country struggles with in trying to find primary care. We can do all we want to increase coverage, that's a good idea, but unless we increase primary care availability, people will have insurance and won't be able to get a doctor. So I hope these people will think about what they have and say, we've got to have something like it. Not necessarily the exact same thing, but we've got to have in our bills improving primary care, having more primary care available to our constituents.
Yes, so good for you that you have it, but make it the standard of care for everybody else too. But is that realistic economically?
Well, in the long run, in theory, good primary care saves money because it cuts down on unnecessary visits to specialists, unnecessary testing. Experts estimate 70 to 80% of what we need can be done in a primary care office. So while there might be an upfront investment, in the long run, it should also be money saving, not to mention better medicine.
All right, Tim. Well, thanks so much. All the years I've been up on Capitol Hill, had no idea that was down there.
I'll take you there next time.
Okay, down behind those doors. Thanks, Tim.